Serological testing plays an important role in poultry disease surveillance and disease investigations. Serological testing begins with the collection of blood samples in the field. Blood samples are then submitted to the diagnostic laboratory, where they undergo testing to identify antibodies to specific infectious agents. Laboratories may utilize a number of different types of serological tests, such as agar-gel immunodiffusion, plate agglutination test, and enzyme-linked immunosorbent assay, also known as ELISA. In laying birds, these antibody detection tests can also be run on yolk samples, providing a convenient alternative to serum testing. For serological testing, you should collect 3 to 4 milliliters of whole blood from each bird. To determine the appropriate number of birds to test, you will need to take into consideration the reason for testing and the test's specific characteristics. Be certain to work closely with your diagnostic laboratory to determine the appropriate sample size. Once the blood samples are obtained, you will need to prepare them for shipment to the diagnostic laboratory. Ideally, the serum should be separated from the blood clot prior to shipping. Serum separator syringes, like the Serum Z syringes made by Sarstedt Monovet, are a convenient way to collect and submit serum samples with minimal processing. Chemically impregnated plastic beads in the syringe help to separate the serum from the clot. Whole blood samples can be capped, the plunger broken, and sent to the laboratory right in the syringe. This procedure works well if samples can be shipped to arrive at the diagnostic laboratory within 48 hours of collection, and the syringes are kept on ice. If you are using traditional syringes, ideally you should process the samples to remove the serum from the clot before shipping. Keep the samples in a warm environment, like an incubator, for 1 to 2 hours. Then, refrigerate the samples overnight. The next day, remove the plunger and pour the serum into a collection container, such as a vacutainer or a microtest tube. You can also centrifuge the samples at 1500 RPM for 5 to 10 minutes. Centrifugation is recommended if the serum does not fully separate from the clot, or you need to maximize the amount of serum extracted from the sample. Most serological tests require 0.5 to 1 milliliter of serum. However, some tests, like avian influenza antibody typing by hemagglutination inhibition, require larger volumes of serum. Mark the tube with relevant information, such as animal number, farm name, flock number, and date. Once the serum samples are prepared, they are ready to be shipped to the diagnostic laboratory. Serum can also be stored at refrigeration temperatures for up to 5 to 7 days. If longer storage is required, serum should be frozen at -20 centigrade. Keep in mind that freezing may alter the results of some tests, such as plate agglutination for Mycoplasma gallisepticum. When interpreting the results of any serologic test, it's important to keep in mind that positive serology indicates that a bird has been exposed to a particular agent. However, it does not prove that a disease condition is caused by that agent. Despite this limitation, serological testing can be used to help rule in or to rule out a disease, conduct surveillance, or to monitor a flock's response to vaccination programs. In disease investigations, baseline samples from normal birds are often combined with paired serum samples taken from abnormal birds during disease onset and convalescence. If antibody levels rise, a process called seroconversion, it's likely that the bird has experienced an infection.